Hi everyone. Welcome to our channel Syncona. Today we are presenting the drug picture of the most commonly used injury remedy Arnica montana. Let's move to the introduction of Arnica. Arnica grows all over the world in the mountain region. They are bright yellow and similar in appearance to the daisy flowers. Arnica is a perennial herb. Its common name is leopard's bane and wolf's bane. The prover is Dr. Sir Samuel Hahnemann, and it belongs to the plant kingdom family Compositae. Comes to the constitution of Arnica patients, they are sanguine, plethoric persons, having lively expressions and very red face. The picture is on the right side of your screen. You can see the picture of a plethoric person with a lively expression and a very red face. Arnica patients are thermally chilly and have nervous temperament. Here we have provided all the pictures so you can remember them easily. They belong to psoric miasm and hematic diathesis. The sphere of action. Arnica acts on blood and blood vessels, particularly on the capillaries. It possesses the power of absorbing blood. Also, it acts on skin, extremities, gastrointestinal tract, and the female reproductive system. Here the pictures are given on to a right-hand side along with the same numbering as the points are given. For example, skin is on the second number, so the image of the skin has the second number on its corner. So this scheme is followed all over the drug picture, so it will be very easy for you to get total image form of the given symptom. Next, we have ailments. From that is the causative factors of the injuries, which patients get from falls, blows, overuse of any organ, strain, and sprain. Mechanical injury from blunt instruments in septic conditions and traumatic injuries. Now, clinical conditions where Arnica shows its action. Abscess, boils, bruises, ecchymosis, hemorrhages, hematocele, eye affection like retinal hemorrhage, fever, angina pectoris, suppurations, typhoid, sprains, injuries and meningitis. Now have a look at picture number 11. You can see the back of a typhoid patient where along with fever, there is this kind of red patches on the back or all over the body. Let's talk about the pathogenesis. By its action upon the blood, Arnica produces anemia, tendency to hemorrhage, capillary stasis, ecchymosis, and defective nutrition. Arnica causes reabsorption of extravasated blood, prevents septic condition, and recovery of the injured parts. On the muscular, serous, and cellular tissues and tendons, it produces conditions similar to those resulting from blunt injuries. It's time for the most important part of the drug picture, that is the guiding symptoms. The patients of Arnica have sore, lame, bruised feeling all through the body as if they were beaten. They are oversensitive to pain. During fever, low muttered delirium is seen. The upper part of the body feels hot and there is a coldness in the lower part of the body. They have the tendency to small painful boils that appear one after another, that is, one heals another appear. Patients bleed easily, blood vessels seem to be relaxed, therefore, extravasation is easy. The bluish-black bruises come easily upon the skin, and internally the mucous membranes bleed easily, also the parts that are inflamed bleed. Arnica can cure hemorrhage of any kind of internal organs or skin. There is concussion and contusion, the result of shock or injury, without laceration of the soft part. Arnica prevents suppuration and septic conditions and promotes absorption. Injury from blunt object, closed internal wounds. Everything on which the patient lies seems too hard, he complains constantly about it and keeps moving from place to place in search of a soft spot. Arnica also promotes hair growth and checks hair fall. It is suited to cases where injury, however, seems to have caused the present troubles, i.e. chronic injury. It also acts in acute injuries. Let's learn about the mind symptoms of an Arnica patient. Patients remain unconscious, when spoken to, answer correctly and completely, but immediately unconscious, and delirium returns. He has a fear of being touched by those who come near him. Arnica patient is morose, quiet, wants to be alone with depression of spirit, and is absent-minded. He is indifferent to everything, completely unable to perform continuous active work. He looks at the doctor and says, "I do not want you, I did not send for you, I am not sick, I don't need a doctor." He will say this even when he is seriously ill. Says there is nothing the matter with him. Sudden fear of death roused him up at night with cardiac distress, especially after accidents. Now, we will see the particular organs, head to toe, which are affected. Head, hot head with a cold body. Meningitis after mechanical or traumatic injuries, from falls, concussion of brain, etc. In eyes, there is conjunctival and retinal hemorrhage, with extravasation, and intraocular hemorrhage from injuries or cough. In gastrointestinal system, there is longing for vinegar, patients have a distaste for milk and meat. There is great thirst at particular times, for instance, during the chill of intermittent fever, he has thirst, while at other times he is thirstless. Offensiveness is a feature of arnica, there is offensiveness of the eructations, belching, foul, putrid, like rotten eggs from the mouth. Patient has constipation, he feels as if the rectum is loaded, but feces will not come out, ribbon-like stools are seen, due to an enlarged prostate or retroverted uterus. There is dysentery, with achuria, fruitless urging, there is a long interval between the stools. Stools are very much offensive, brown, bloody, putrid, and involuntary. Involuntary urination, very painful micturition, also the retention and incontinence of urine after labor is seen in females. Next is extremities. Ascending type of rheumatism is the characteristic feature of arnica. There is a great fear of being touched or struck by a person coming near him. Pain in limbs and back as if bruised or beaten. They can't walk erect on account of a bruised sort of feeling in the pelvic region. Arnica also acts upon female reproductive system. When there is soreness of parts after labor. It also prevents postpartum hemorrhage and puerperal complications. Retention or incontinence of urine after labor in females. In skin, there is tendency of appearance of small painful boils, one after another. The affected part becomes blue and black with extravasation of blood, ecchymosis is seen. The affected parts are extremely sore, painful, and sensitive to touch. Injury of arnica is very important, it can come for a short note. Injuries resulting from fall, blow, contusion, traumatic and mechanical injuries, even if received years ago. After injuries from blunt instruments. Or compound fractures and their profuse suppuration. Arnica prevents suppuration in septic conditions and promotes absorption, in both acute and chronic injury. There are bluish-black bruises, shocks and injuries of joints, and injury of the back with lameness and soreness, which is very painful to touch. Also, there might be concussions and contusions, results of shock or injury. Fever of arnica can also come as short note. It has two types of fevers, typhoid fever and meningeal fever. In typhoid fever, there is sore, lame, bruised feeling all over the body. Great restlessness, everything on which the patient lies feels too hard, so he constantly moves from place to place in search of a soft spot. Low muttering delirium, that is, the patient lies unconscious, when anything is asked, he answers correctly and completely, but again becomes unconscious, and delirium returns. He says that there is nothing wrong with him and he is totally fine. During fever, there is involuntary evacuation from the bowels and bladder. Patients also produce offensive discharges, for example stool, urine, sweat. In meningeal fever, the upper part of the body is hot and the lower part of the body is cold. It is also one of the peculiar features of arnica patients. Lastly, the modalities. There is aggravation, from least touch, motion, rest and in damp cold weather. And amelioration, from lying down or lying down with head low. This is from our side, and we would like to inform you that the books that we have referred to make this presentation are from authentic sources. We have used books of Homeopathic Materia Medica by J.T. Kent, William Boericke, Allen's Keynote, S.R. Fudak, etc. Thanks for watching. Reminding you to be wise and hope you enjoy the video. Please like, share, subscribe and give your valuable suggestions in the comment section. Happy learning.